All right, so welcome back, everyone. So we are continuing our discussion on Women's Eye Health Month, which is April, and we're speaking to Surgical Services Manager Prianka Persad. Ms. Persad, thank you very much for staying with us. All right, so Ms. Persad, let's try again. So we were speaking about vision loss among women, and the cases among women concerning vision loss, it's very high. That is new news to me. What's the situation as we look at vision loss among women in Trinidad and Tobago?
So we would generally see a lot of women coming in with conditions such as cataracts, glaucoma, refractive errors, age-related macular degeneration, which can cause a disruption to the central vision in our eyes. And also women with autoimmune diseases. These autoimmune conditions tend to contribute to inflammation, which can cause visual hindrances in the eye. And we notice that women are more predisposed to these types of conditions because we have a lot of changes going on within our bodies.
Yeah. And I was just going to ask, what is contributing to all of these eye ailments among women?
So definitely the hormonal fluctuations, and we see that especially during pregnancy or menopause, but there are also a lot of genetic predispositions. And of course, systemic health conditions, for example, hypertension or diabetes. And diabetes, as we know, can also lead to significant visual impairment if it remains untreated or uncontrolled. It can lead to potential blindness.
Yeah. So some of the diseases being experienced, it is because of our lifestyles, right? And if we make changes, we adjust our lifestyle, it could prevent us, or women, from having vision loss.
Correct. So, I mean, usually we would eat a lot of fast food and stuff, but if we consider adding some more fruits and vegetables and just have a balanced diet, that is a key factor in helping to promote better eye health. Also, including your omega-3s, even exercise, adding that to your daily routine, managing your stress. And if you're a smoker, you might want to quit smoking because studies have shown that smoking can lead to an increased risk of age-related macular degeneration.
Yeah. But what are some of the red flags that women should be looking for? What are some of the symptoms that people may think, I think that I may be having eye problems, What are some of the symptoms you think?
I think not just women, but everybody should look out for any sort of change in their vision. So if you're having blurry or distorted vision, redness, itching, burning, sensitivity to light, floaters, or flashes of light, or any sort of discomfort in the eye, you definitely should go to your eye care professional, whether that's an optometrist or an ophthalmologist, so that they can take a look and advise you if there's any changes occurring within the eye.
Yeah. But you know how we are, Ms. Persad, that we like to put things off and put it off and put it off and put it off. And I'm sure my question is a rhetorical question. That should not be done, right?
Of course not. It should not be, because if you keep putting it off, then if something is changing in terms of your vision, you want to be able to plan for treatment because you want to prevent any further visual impairment. Which may lead to blindness if left untreated or uncontrolled. So you want to make sure that your treatment is tailored to help with preventing any sort of vision loss, either in the near or distant future.
Yeah. Let me ask a question, and I'm not asking this to be controversial, Ms. Persad. I'm not trying to put you in any heat this morning. But there are optometrists and there are ophthalmologists. How do people make a decision as to who they should go to for treatment?
So optometrists are really like your first step They will do your general evaluation on the eye. They look at the back and front of the eye. And if they pick up any sort of change occurring, they will advise you and they will refer you to an ophthalmologist who will then do further treatment and investigation and surgery if needed.
Yeah. Well, that's a good explanation. We'll stop there, Ms. Persad. I don't want you to get in any trouble, right? But as we observe Women's Eye Health Month this month, what's the message that you want to give people?
You know, women play such a major role in society, in their families, as leaders, as supporters to others, as nurturers. You know, they may not be able to do their surgery for cataracts this month because they need to use that fund to buy school supplies for their kids. And so they just end up waiting and waiting until their vision keeps deteriorating and, you know, eventually they may get blind. But advocating today for women to start putting themselves first, prioritizing their health care, specifically their eye care, and get their annual comprehensive eye examination so that, again, if something is changing in the back of the eye or front of the eye, we can treat with it because vision is not just sight, vision is life.
Yeah. Are you all seeing eye problems at an earlier age? Because as I what's the word I'm looking for? I'm just thinking that I'm seeing more and more, and I don't know if that is just my view, that more and more children are wearing glasses now. So is it happening at an earlier age?
Yeah, actually that is true. Because a lot of kids use these screens, their phones, the iPads, tablets. They use it so much. They tend to develop myopia or short-sightedness. So they are advised to go to their optometrist or their doctors so that they can develop a plan of treatment for that.
Yeah.
Because it tends to progress. So it's better to, you know, treat it early.
So it is happening at an earlier age now, you think?
Sorry, I didn't hear that.
So vision loss is happening at an earlier age than what would have transpired, let's say, 10, 15, 20 years ago?
Yes, there is some studies showing that we are picking up a lot of kids with short-sightedness and they are coming into the clinics. We also notice women from the age of about 40 will tend to develop some eye changes and they develop cataracts and stuff at an earlier age as well. So definitely we are recommending any sort of change, you need to go to your doctor.
Yeah. What disease you think is most susceptible when we speak about vision loss? Is it cataracts? Is it glaucoma? What is it that you're seeing in most cases now?
So cataract is one of the most common eye conditions, and this is because it really is an age-related change. So a lot of people will develop that as we get older. It can be treated simply with surgery. I say simple, but it's still surgery, but it's a routine surgery for us. And it is something that will give you just a simple blur in your vision. So you might think, oh, well, it's nothing, and you leave it, and then keep progressing. So if you notice that, definitely go to your eye care professional.
Yeah. Let me see. Is there anything that you'd like to tell us this morning that we have not touched on that you think it is of importance that you'd like to tell our viewers this morning?
I might just want to stress that if you do have any underlying conditions, you know, like diabetes, that's a significant one. Definitely go to your doctor to manage the diabetes, but also see your ophthalmologist because diabetes can affect the eye. So significant screening and management or full management is required. So definitely make sure you get everything treated.
Yeah, but I think it is safe to say that vision loss is treatable and in most cases preventable, right?
In most cases, yes. There are some conditions like glaucoma, which, if it's not treated, it can lead to blindness. And unfortunately, sight loss from glaucoma is not sight that we can restore. So if you are coming from a family with a history of glaucoma, definitely eye screening is recommended.
Ms. Persad, thank you very much for speaking with us this morning. We do appreciate it. Bye for now. Okay. All right, so that's going to do it for our show for today. But before we go, we leave you with this image captioned Sunset View from Tabaquite. It's from Avion in Whiteland. Avion, have a good day. See you tomorrow, everybody.
Like his grandfather, Pakalinda, and grandmommy, sweet Cariso. The family traits of little boy Soka. Could I never hide me just so? He is the head of the fetting.